Imagine trying to get a diagnosis for 4 months, only to find yourself back in the office where you started, in your primary care provider's office, the same waiting room, the same chairs, but this time around with no answers, a bunch of copays, and as a matter of fact, I even begin to suspect that the system was truly never really designed to help you. That's not a rare experience. That's a Tuesday in hell. I am Dr. ChiChi, and today I want to talk about something that I see happening very often. As a matter of fact, has happened to me. It is called referral runaround. I'm going to talk about what it is, why it happens, and most importantly, how to solve it. Let me walk you through how this normally goes, and you're going to tell me if it sounds familiar. You have a symptom, that has been going on, off and on, and you simply cannot just, shake it off. You call let's say the symptom is maybe chest pain or a joint pain or even maybe chronic fatigue or something. You call your primary care provider's office. It takes about 3 weeks for you to even get a slot. You go for your appointment, sit in the waiting room for maybe an hour or even 2 hours past your appointment time. And then you go in to see your primary care provider, and he spends 12 minutes with you, does a brief exam, maybe, and also some labs. And then he tells you, I have to refer you to a specialist. Okay. You trust your primary care provider. You call your specialist office. And then sometimes you have to wait for 6 weeks, most times 3 months before you can even get an appointment to see your specialist. You finally get your specialist appointment. You go there and then he asks you to repeat your entire history because why? Your records didn't get transferred to them. They run more tests and they say something that makes your stomach even drop. This is actually outside my scope. You need to see someone else. Another wait. Another referral. More out-of-pocket costs. More days off work. More explaining yourself to somebody who you're just meeting for the first time. I kid you not. This is the point where most people just get tired. Around month 3 or 4, millions of patients make a decision that I completely understand, and it really breaks my heart as a physician. They just give up. As a physician, and as somebody who has actually been through this, I want to explain to you why this happens, because I truly understand that understanding the system is the first way to surviving it. First, referrals are not the enemy. I have had a couple of patients say to me, why can't one doctor just take care of all my problems? Why do they have to refer me to somebody else? But I want you to know that medicine is deeply specialized, and your primary care provider cannot do the work of a cardiologist. He cannot do the work of a rheumatologist or a gastroenterologist. These specialties exist for a good reason. Problem is not the referral itself. It's the things surrounding the referral. And I'm going to explain it to you one after the other. Number one is that records don't get transferred automatically. Here in the US, some health systems don't even talk to each other seamlessly. So you have your notes, your imaging, your labs in one system, and then it doesn't even get to the specialist where you were referred to before your appointment. And so you get there and you have to start all over. Number 2 is the scope disputes between providers. One provider thinks the cardiologist needs to manage this. You go to the cardiologist, he's like, no, this is not for me. It is for somebody else. And while they are trying to figure out who should manage what, you're the one sitting in limbo. Number 3 is insurance gatekeeping. Here in the US, some referrals require pre-authorization, and that can even take up to weeks before you can even get a date. Number 4 is capacity gaps. In Nigeria, where I'm originally from, you have scarcity of specialists. Sometimes it's a ratio of 5 physicians or 5 specialists to thousands of patients. That scarcity of specialty care is a different kind of problem itself. Number 5, and this is the one that matters most. There is nobody that is assigned to make sure that you complete your referral loop. This responsibility falls on you, the patient who is already unwell. Studies have shown that an incomplete referral loop actually worsens outcome of diagnosis. Chronic conditions become unmanageable, and there is an increased rate in dropout from care, especially in underserved communities. Now, this is not a minor inconvenience, it's a public health failure. Let me say something to somebody who had probably given up in the whole of this process. You were not weak, you were not non-compliant, you were not a difficult person. You were just a person trying to navigate a system that was never designed with your experience in mind. It's a natural response to just give up, after being bounced around. Now, I'm not saying this to excuse the system. I'm saying it because I do not want you to carry the blame on yourself. Let's talk about what you can actually do to solve these problems. Because talking about only the problems without preferring a solution is not medicine. That's just me venting. Number one, when your primary care provider refers you, ask for a warm handoff or a referral coordinator. Just ask and say, is there somebody who can help coordinate this whole referral loop? Most offices have it, but patients do not know. But if you ask, then you know if they do or do not. Tip number two is carry your own records every time. Here in the US, under HIPAA, you're allowed to get printouts of your labs, your imaging, your notes, and you can take it to your specialist's office. It is wrong for you to assume that your records are being transferred. When you get there, it may not be there, and then you have to start all over again. In Nigeria, it's the same thing. You can ask for printouts of your discharge summaries and have it in hand. Take this hard copy to your specialist's office or your specialist appointment. Tip number three, close that referral loop after seeing your specialist. Call your primary care provider's office. I saw Dr. XXX and X. Did you get his notes? Did you get his recommendations? You see, this loop is left open by the system. You, the patient, is meant to close it by default. Number four, know when to escalate while you're waiting. If your symptoms change, call your primary care provider's office. Tell him that your symptom has changed and you are worried. This can help him expedite your specialist appointment or even redirect you to the ER. Fifth tip, and this is specific to those in the US. Check to see if your insurance has a 24-hour, 7 days a week nurse line. Most plans have it, but nobody even gets to use it. If things begin to progress, you can call that line when stuck in a referral limbo. Remember what I said from the beginning? 4 months, back to same waiting room, same chairs, worst part, no answers. Now, here is the thing about that person. They were not failed by their doctor. They were only failed by a system that assumed that they should be able to figure things out themselves. You do not need to figure things out alone. You need to know the plan. You need to have a plan. You need to have your records, and you need to understand that asking questions does not mean that you are difficult. It only means that you are your best advocate. That is what this channel is here to help you do. If this video gave you something useful, there is somebody in your circle who is sitting in a waiting room, either physically or metaphorically. Send this video to them. Once again, I am Dr. ChiChi, and this is Everyday Health MD.